So this was the first time that Project Helping Hands, the organization that we went down with, had been asked to specifically put on educational symposia for physicians instead of the usual teams from the U.S. going down and delivering medical care directly in outer areas. And so we went in and did 3 seminars for physicians and pre-hospital providers, which had not been done before in Bolivia. So we were in La Paz, which is the capital city. It's a city of about 3 million.
Because it's a very poor country, the amount of technology that is available to them, everything is donated or many years old. So one of the big challenges was bringing the information to them without relying on the technology that we use on a daily basis. So we could talk about the use of a CAT scan, but they've got one CAT scan for the entire city. We could talk about the use of various markers for cardiac disease, but they don't draw blood on a regular basis, and if they do, they have to send it out and get it back a few days later. So a lot of the information that we gave them was very rudimentary treatment regimens, and when it came to pre-hospital care, they don't have an ambulance system that is similar to ours. They throw them in the back of a hearse, much like Ghostbusters, and run them to the hospital. So there's very little pre-hospital care. So giving them just the basics of, this is what a backboard is, this is what a cervical collar is, and this is why it's useful. These are the appropriate treatments in the field that you can do. It was something that they've just never done before, and they're currently not yet even stocked or staffed to do.
So what we have done is, and part of that going in there was realizing that we couldn't take lessons learned from the U.S. and apply them de novo because they don't have the infrastructure. And so we made efforts to really think about what could we provide to them that they wouldn't require technology, that they could start thinking of and possibly doing and applying, even given their limited resources. And one area in particular that they are very, very interested in is disaster preparedness. They realize that since they lack the infrastructure, they've got to start someplace. Where should they start? And it's sort of very humbling when you realize that things that we take for granted they don't have, and so you can't simply say, well, you should do X or Y. It will never happen, and so you really have to start from scratch and say, what are the resources they have? What's realistic to expect them to do? And how can we help that system move?